next is basically Zeenat. You kind of saw some of her, perspectives in this panel. So she's going to be talking more about, specific use cases in healthcare. And Zeenat is a distinguished professional with extensive experience in corporate development and business partnership. She brings a wealth of experience that's gathered from both multiple roles in venture-backed startups, as well as some corporate world, some experience from Google, and then she really has a very interesting entrepreneurial journey. So we're going to be hearing from her, and she is also going to be part of another track later on today, so stay tuned. Zeenat, the floor is yours.
Thank you so much for that lovely introduction. And hello, everyone. Good afternoon. It is a pleasure to be here. I had to go on trains, planes, almost horseback to get here. So it was a long journey for me. And to kick this off, one, please accept my apologies here. I've had 3 hours of sleep. So we'll see how far I can get through this. And I know that I have a 20-minute talk, but I want to make sure this is more of a conversation. So at any point, interrupt me, ask questions, argue with me. I'd love to hear your perspective. And it's wonderful, actually, to be in a room to talk about STEM and data science and healthcare, and to see 75% of the audience is women. This is such a treat, because this rarely happens. So I really want to applaud everyone here. And a well-dressed audience as well, wearing lots of colors. I don't see that very often. So thank you so much. Before I get started with my presentation, do you need me to? No, not me. OK. Before I get started with my presentation, I'm going to ad-lib a little bit, because I'm here to talk about generative AI in healthcare. What is the hype? What is real? What can we actually do with it? And on my trip over to Beirut, I actually had an experience that I think highlights how we handle crisis management in healthcare today, and what we actually could have done in this situation with generative AI tools that have made the situation much different. And so I'm going to kind of ad-lib here and tell my story, and I'm assuming that this might be familiar to many people here. On my flight over to Istanbul, the pilot got on the PA and had that dreaded call, which is, is there a medical doctor on the plane? Now, for most people on a flight, that's kind of a horrible situation to be in flight, to have a medical episode that you actually need acute care on the spot, except if you are an Indian woman who disappointed their parents by dropping out of medical school. This is when my dad wished that I could raise my hand in that situation. But what ended up happening was, there was a young child on the flight that had an allergic reaction and an anaphylactic shock mid-flight. And so they looked for, someone on the plane to support this patient. And after kind of 30, 40 minutes, they decided to make an emergency landing in Sofia, which ended up being another 30 minutes to get this patient on ground. And then another hour passed before, we were able to take off again. So 2 hours of time kind of passed, and unclear what happened to this child, but a very terrifying situation. So I just did some kind of analysis and wanted to see what is the actual likelihood that a physician is on a flight of 300 or 400 occupants. It's about, for every 12 flights, 11 flights has some sort of physician or nurse on the flight. So if there's a medical emergency, there's someone there. Now, I think worst case scenarios, you get stuck with a pathologist who never interacts with humans, and that's a whole other situation. But a lot of time was lost. And as we all know in healthcare, time is the most critical thing you have. and every second is very important, especially in an acute situation. So let's take this scenario with the tool of generative AI. Wouldn't it be amazing if in that situation you have the pilot and the, I don't know what the correct terminology is, the flight attendants, the air stewardess, I don't know what is the new term today. But they typically are not trained to deal with acute health situations. Now all of a sudden that we kind of arm them with an AI doctor, and they can have a conversation on the spot and have all the support and expertise available to them to actually act and care for this patient in flight. So now we can take that time from 2 hours down to 5 minutes, and you have global expertise. And as we know, the medical field is, one physician does not solve all of our problems, right? We have maybe 300, 400, 500 specialists with a whole field of an intense amount of information that you can have in that moment. You can now put on that flight critical medical therapeutics like an EpiPen or whatnot to help with these acute situations. And now within 5 or 10 minutes, you have a full care for that patient in flight that actually could save that person's life, right? Versus kind of the 90 minutes of getting on the ground and starting. So that's the power of generative AI in the healthcare space. It democratizes expertise to all of us immediately, and it gives us access to care that many of us don't have unless you're in a geographic situation that you can meet those specialists immediately. So that was just kind of the beginning here, which really highlighted for me why this topic is so important and how it can be utilized on a day-to-day basis. So the market for AI in healthcare is huge. You know, we're looking at today, it's about a $10 billion market, but in the next 10 years, it's going to blossom to 300 billion plus. So it is amped for disruption. It is amped for utilization of these tools to really enable us to provide better care at the point of patients. And for anyone who works in the healthcare field, it is a co-pilot and a conductor for all of the new information that's coming out, new research, the plethora of data that makes it very, very difficult to be at the point of care to service the patient because you don't always have time to train and to get access to it. So that's really the power here. So, you know, I think that there was a TED Talk this past week with Vinod Khosla, and his dream of the future is that expertise will be near free. And that, you know, that is probably the ability to give 8 billion people access to the best and highest standard of care out there. What does that mean in a crisis situation? What does that mean globally for us? So I just ran some numbers, like for every individual in the U.S., every physician in the U.S. kind of services 300 individuals. Here in Lebanon, it's for every physician, they service 900. In crisis zones, it can drastically get much worse. Gaza wasn't that bad. It was 1 in 775. But in Ukraine right now, for every one physician, it's about 2,500 patients they service. So how can we really tighten that so that it's one-to-one? And this is where AI agents come into play. I think that this group is extraordinarily well-versed in the data science component of it and the technical foundations of large language models and diffusion models. So I am actually going to skip over a lot of the technical components of this. But if that is not the case, please speak up now, and I'd be happy to go through it. Or we can always have an offline conversation of what these models are. But the power they have in healthcare is twofold. One, from a biological standpoint, like the power of large language models actually follow in the way that parallel sentences from a large language model as to how we think about biology in terms of DNA, RNA, and proteins. So that model perspective kind of is very comparable across the board from a biology standpoint. And then for the second part, I've kind of beaten a dead horse here, but large language models in healthcare will transform our ability to have extensive medical literature and patient data to provide valuable insights to give accurate care at the point of care and the point of incident. So, one of the things that we covered in the last panel, but didn't actually go into great detail, is why this time period is so important for human innovation and human development. So there's, probably at most maybe 20, 25 innovations that really transformed human civilization. There was the printing press, which all of a sudden enabled information to get spread pretty ubiquitously. There's penicillin from a healthcare perspective. There's transistors from a computational standpoint. We are all living through this point of probably one of the biggest innovations of the past 100 years. So be excited. This is, where we can really see transformation, and this is a very unique position we have at this time period. So, as we look at the generative AI roadmap, healthcare is very unique because unlike other industries, we've been very limited by the quantity and quality of data. And for anyone who's worked and done data science in the healthcare domain, it's a mess. It requires a lot of data hygiene, a lot of chasing down of longitudinal data sets, the inability to understand someone's entire medical record. So right now we're in this explosion of biological and healthcare data. We're at a point where biology is now scalable. We have advances across a whole host of new computational tools and modalities, including gene editing, CRISPR technology, kind of unlocking every core component from DNA, RNA to proteins. So we really can use this data to drive immediate feedback loop for our development. I come from a therapeutics background, so our development of drugs and how it interacts on a personalized way with individuals in their disease progression. On the kind of larger healthcare side, one of the biggest issues has been the uptake and utilization of technology to really move us forward in how we collect and use that data for treatment. And there's two real areas in how we think about healthcare. It's improving outcome, decreasing costs, and driving that patient-physician engagement to have the human touch behind it once again, where you actually have trust, discussion, and history with your physician beyond just looking at a file. So I think this really enables that. So I'm just going to take a quick pause here because I'm going to go into case studies, and I'm going to kind of put forward where startups and early entrepreneurs actually have a potential advantage in building tools, AI agents in healthcare that could be very impactful. But before I go there, are there any questions or comments on anything that I've said to this point? Yes, the man in the back. So I think if I understand your question correctly, you're asking why is this point of time uniquely different than the last 50 years, and why all of a sudden can we actually utilize large language models?
Yeah.
So And are you asking specifically to healthcare, or are you asking kind of across the board?
Yeah, in general.
In general, well, I think it comes down to the Transformer paper of 2017, which actually kind of transformed the speed at which foundational models are being built and the ability to use multimodal data sets and push that all together in a meaningful way and have a computational model not only ingest the information and push out an outcome, but also have the conscious ability to engage and interact with that data. So that's uniquely different. What I can say in healthcare and maybe in other kind of similar industries is we've had this explosion of our understanding of the human body. We've had a lot more abilities to have tools to interrogate biology, which in terms have given us a lot more data to engage with. And I think also from a healthcare perspective, we now are all having real-time information of our lives through Apple Watch, et cetera. We're having a lot more data on our day-to-day health that we never had before when you were doing checkups with your doctor maybe once every 3 to 4 months. So that data explosion in healthcare kind of in conjunction with these new tools have made this time ripe. Does that?
Yeah, so it's more data and the computational power that we have now. Is that right?
Yes.
Thank you.
Yes, and NVIDIA. Yeah, without NVIDIA's AI chips, we probably couldn't do what we're doing today either. So that as well. Those are all in alignment. And just as a time check, how much time do I have left? 5 minutes? Okay. All right, so with those 5 minutes, I'll just go through 2 case studies and then happy to take this offline to anybody who wants to discuss in more detail. So the first one is, in terms of crisis management, how do you get all the expertise and information of different specialties at your fingertips? So Cure Health, which is based out of San Francisco, is scaling the primary care physicians and being able to give everybody the opportunity to have a bi-directional conversation where you can actually engage with an AI doctor, and that's your first line of diagnosis. The reason that this tool and these AI doctor agents are actually a lot more effective, in my opinion, than maybe an individual physician is because they can collect a ton of data from the World Wide Web that incorporates not just the symptoms that you're presenting, but information in regards to specific geography, weather, health outbreaks in that situation that they can pull together in real time within seconds to provide a very accurate diagnosis. So let me give an example because this happened with Cure Health and I thought it was very interesting. So a patient presented with a respiratory infection. And this person was, in kind of California. And if they'd gone to see their local physician, kind of the workup to figure out what was wrong with them probably would have been 2 to 3 weeks. And that local physician would have knowledge of that local region to what was happening. But because this person was able to communicate with the AI doctor and tell them that they were in a desert location for the past week, the AI agent was able to pull immediately that there was a fungus growing in that desert at that time, which led to different types of infection, and there was, 10 or 20 other patients that kind of presented with this respiratory illness. So they were able to provide an accurate diagnosis on the spot of what ended up being a very rare respiratory issue that would not have been otherwise identified, immediately had that been with a local physician. So as you think about, in healthcare, we think about accuracy a lot. And for anybody for all of us who've ever been sick, it's not that accurate, right? You have to talk to there's more of an art to medicine at times. And here we actually can pull a lot of different information, different categories of information that help to get you to an accurate diagnosis that then your treatment plan follows from that. And then in terms of, I think in healthcare, we're very concerned with hallucination. And as part of a lot of what these companies are doing well, including my previous company, is we're doing a lot of peer-reviewed and citations to really kind of provide that transparency to the greater good. And also creating kind of secondary agents that interrogates and goes back and forth with the data set to provide guardrails around the outputs from these foundational models to kind of determine the risk probability of these outputs and whether or not they are real versus have inaccuracies around that. And I think that is an area, as we talk about AI responsibility and checks and balances, that we will need to monitor and potentially have regulatory monitoring around that, because patient data and patient care is such an added risk than most other industries have. So with that, I'm kind of going to end with this case study because I think I only have a very short amount of time left. But want to open it to the floor to take any other questions, and happy to make this presentation available because there's about 4 or 5 other cases, including my own company, that's worth discussing. The man in the back.
Just one question. What about deadly mistakes? That's what my only question. Deadly mistakes. If we ask Google, my stomach hurts, it gives me cancer.
Yeah.
Literally, I'm not kidding, Ajad, but
yeah. No. It's a fair point. It's a fair point. So I want to emphasize that it's not the truth. It's not. These agents are co-pilots. They are providing a group of information for you that is a risk probability of what is the potential options that you have. But it's not the full truth. And that's where that physician relationship is still very important, to have that as a core component of this conversation, to double check all that information. But it is an agent. Now, I'm actually a little surprised to hear that Google told you had stomach cancer, because they're not actually supposed to do that. But I think that this is a fair point, that we don't want to create unnecessary fear, anxiety of misinformation that's represented if we don't actually have the final truth behind that data.
So just following up on the point, so from a legal perspective, I mean, it's very easy right now to have, given the open source and all of that, to have something available for all patients. So from a legal perspective, do we have certain regulations that are enforced before something like this maybe gets to the users, to direct consumers?
Yeah, and this is where I don't have, I'm a little bit, I'm not knowledgeable here in Lebanon as to what is the rules and regulation. I can talk about it from a U.S. perspective because we have very strict rules and regulations. We have, the governing body of the FDA, which all decision support tools need to be approved through their AI process. It's a very rigorous process that puts patients first, and it's kind of the governing body that I think the global world looks towards. And then we have very strict policies around patient data and its use and its de-identification. That's through our HIPAA and high-tech regulations. So we have a checks and balance. And I would assume that most countries have a checks and balance as well. I'm not as clear as to how it's regulated here. So if there's anyone in the audience that has that expertise, it'd be great to hear. But we do have that, and it's a lengthy process, which as you think about, so I think a lot of people here are researchers, but as you think about deployment of your research findings into a product, that timeline, in a lot of other spaces, you can push it out immediately. In healthcare, you can't. It's, at this point, a 3 to 5 year endeavor. We might have shortcuts to make that faster. but you're still looking at a long timeline. So if you're looking at businesses in this field, it's a much longer horizon. Yeah.
Thank you so much. I mean, the risk that we're all is concerned about using AI is the same risk, if you allow myself to say, the same risk using, let's say, CT scan or any diagnostic tool in medicine, let's say. If the CT scan is not calibrated well, and then the images given by the CT scan will be interpreted, with lots of misinterpretation by the physician, by human beings. So the risk is there.
Yeah.
Okay. So let's look into the positive things of or the opportunities the AI will provide us now, using this the augmented realities, which is beyond the virtual realities. Augmented realities, let's say during in an operating theater or theater, then it gives physician more in-depth information while operating, while dealing with nerves or veins or something. So it gives the holistic overview, 360 degrees, not only the seeing the patient in 2Ds, it shows maybe 4Ds rather than But this is commenting on about regulations. It's same everywhere. So physician is in charge of decision making, and physician will hold most of the responsibilities, if not all responsibilities. But my question to you, first of all, thank you so much for this insightful presentation. But my question is about your first slide about reducing cost. I'm not sure how AI will reduce cost. Certainly, it will give a better, a faster decision making, because it correlates all the information and better decision making. But for cost, I will have to raise question here, because in medicine we rely on technologies and providing us diagnostic information. Let's say using robotics, everybody is excited about robotics. So let's get rid of the Da Vinci SI and use XI. It's double price. Yeah. XI double price. So and healthcare cost is increasing So I have to raise question about reducing cost, if you allow me. Thank you.
Thank you. So let me see if I can break down that into a couple of easy bite sizes here. So on your first point in the beginning, which was around data integrity, and I think like all models, garbage in, garbage out, right? So a big component of healthcare, whether it's imaging data or longitudinal data sets, is cleansing of that data. And if you look at where most of our time is spent, it's still spent on cleansing of that data and normalizing and standardizing it. I think with a lot of these tools that are point-of-care tools that can be utilized off your mobile phone, there's an opportunity to normalize that data globally much faster. But I can share, having spent my career in this, it's a data mess. We spend most of our time cleaning data, especially in different geographic regions. It's very, very different. So that's a problem with the system, with the disparate systems that we use in place in healthcare, and not having a standardized way that we work in any location. So on your point around surgical robotics, I actually saw, I'm going to hold off on answering any questions there, because I actually saw that my friend Jean Neme is going to be on campus on Wednesday. He's the founder of Touch Surgery, and I think he would be able to answer those questions with a lot of insight from his 10 years building that. But on the part about cost, healthcare cost, what you shared is a limited window of one area of cost. You're basically saying this capital equipment is twice as expensive. But that cost of the healthcare system is probably less than 5%. If we look at why we have a huge healthcare burden globally, it comes down to the last mile. You know, you spend your millions of dollars on care at that last length of life or that huge heart attack that you have. That's where cost comes into play. So where can AI reduce costs? Faster diagnosis, getting to the problem earlier, having the right care immediately upon a medical issue, because that actually prevents downstream cost. And that's where we can preventative care, diagnosing with the right diagnosis, having the right care at that point, that's where cost can be saved. We come back to that airplane journey that I had here. I can't imagine how much cost they had, right? Just in terms of having to refuel and stop and all of us getting delayed and rebooked. While an AI agent with an EpiPen would have been a $600 cost with no burden to the rest of the 400 people on board. So that's one way to think about reduction of cost. Okay, no more. All right, thank you, everyone.